Welcome back to the podcast, Dr. Anna. Thanks for joining us today.
Oh my gosh, I've been so excited all day that I get to chat with both of you. Thank you for having me.
Yes, it's such an
Same.
honor. We are so thrilled to have our girlfriend, Doctor, back on the podcast. We had you on in August of 2021. I don't know where the time has gone, but we did a pretty deep dive back then on menopause, on your test don't guess approach, the importance of oxytocin, which I know you still love talking about, your amazing product line, but you've created some really cool stuff. And you were just featured on the cover of Women's World magazine. I don't know if you
I
want to
know.
hold it up and show for
Yes,
anyone watching the video.
so excited. So at
Yeah.
58 on the cover of a magazine, we gotta love it.
So
So no
fabulous.
boundaries, no limits. And they did a nice article on it. And yeah, so super, it's well written. It's very much an honor to be featured. So excited.
That is very cool.
Sitting on
Absolutely.
newsstands
Congratulations.
too. It's kind of fun.
Woohoo.
Yeah, wearing
Yeah.
your power red. I love it.
Oh, absolutely.
Yeah.
Yes.
So, because we covered so many amazing topics in our last episode, it's been 3 years. We know the health space is ever evolving through research, clinical experience. What we really want to know is what's new in your world, and perhaps what have you changed your mind on in relation to women's health in the last 3 years?
Yeah, I think as as being on the forefront of leading and coaching women through menopause and understanding the menopause journey, and really that menopause is natural and mandatory if we're blessed to be able to go live long enough to go through menopause. But menopause is natural and mandatory, suffering is optional. And I really want to emphasize that point. I think with all the buzz around menopause, it's being looked at as a disease state, and it is no more of a disease state than puberty is. And it's an empowering state. And we choose to look at this time as being empowered, this rewiring, just like we have rewiring in puberty. And and that it leads us into our second spring of our life. Like, how do we want to live during the second spring or our second 50? And what does that look like for each of us? I don't want to see dreams squashed. I don't want to see people suffering. I don't want to see people's any woman's issues minimalized either. And so I want to look at and really bring the conversation towards empowerment of our bodies, because so much is within 99%. I mean, we can do a little bit with hormones, and that can be really game changing for so many, but it's 99% within our own power through the lifestyle changes, through our mindset, through the activities we have, through the food we eat. Food as medicine is truly within our own control. And so that I want people to look at it as empowerment. So I think, and whether it's you're before, during, or after menopause, the other piece post pandemic, because there's been more hormone disruption that I've seen post pandemic, whether it's stress, whether it's COVID, whether it's, whatever medications, et cetera. We look at, okay, how do we empower our body again? How do we boost our immune system? So to look at the way medicine has even changed pre-pandemic to post-pandemic, I think it's worth talking about, and certainly something that I have been honed in on certainly over the last years as I've entered back into practice after having a sabbatical or retirement for quite a while.
The people
Oh,
need you. Thank you.
yeah.
Come
Yeah.
back.
And I
Yeah,
love
I mean,
it.
how
I
could you
love it.
not focus on that? It's been such a huge thing. So has that changed the way that you practice, or it's just an added challenge on top of what we're already dealing with women's hormones?
Yeah, no, it has changed. It really has changed. And I think because I had that gap where I've retired, a few years pre-pandemic, and then I came back in, into clinical practice July of 2023. So, okay, what happened during that time and what I'm seeing now? So, what I see now is autoimmune conditions, a peak in viral titers such as Epstein-Barr, mononucleosis, environmental toxicity issues that people, powered through before, but now it's taken them down. The hormonal issues, the ovarian dysfunction. And so we know that spike protein can concentrate in the ovaries in women and the testes in men. How is that affecting us hormonally? And how is it affecting us in the next generation if we choose to have children? And so what I've seen is clients coming in with early menopause, clients coming in with, infertility diagnoses in their 30s. And of course, that speaks to me because I was one of them, now almost 20 years ago when I was diagnosed at age 39 with infertility and then early menopause and was told I would never be able to have another child. So I was able to reverse that with the grace of God and just kind of empowering our body's own natural ovarian function and reserve. So there's I call it ovarian resuscitation. So
Yeah.
through that, and then what I learned in my own journey and being able to apply with clients, it's powerful. So let me give you an example. So one of my first patients coming in back into practice was this lovely 39-year-old woman who um, had one child pre-pandemic. And then during the pandemic, she had a trisomy child, which ended in an early fetal demise. And then she had another miscarriage. And then she was seen by infertility specialist. And she was told, look, there's no chance. Your AMH is basically zero. I think it was 0.1 or 0.01 or something very, very small. And, we want to see at least an AMH in whole numbers for sure, but definitely greater than one, preferably greater than three. So what I did with her is like, okay, I don't know as far as regarding your pregnancy, what we can do, but I need for the next 3 to 4 months, I wanted to work aggressively with you to support let's do what we can to support and repair your ovaries and your entire hypothalamic, pituitary, thyroid, adrenal, gonadal axis. So usually for short, we say HPA axis, but there's a lot more to it. So this brain body connection, and let's detoxify the body because there were inflammatory markers. And so I started working with her. We did high dose vitamin C IVs, a couple rounds of IV ozone. I put her on my foundations, which is MightyMaca Plus, my balance cream, which is progesterone and pregnenolone, and my detox program. So I had her follow the medicinal menus in my book, Keto-Green 16, had her use MightyMaca 1 to 2 scoops twice a day, and the balance cream from after ovulation, if she was to experience, or day 14, till day 28 or till her period came. And then the other detox phase 1 and phase 2 detoxification support, which from my product line is my Keto-Green detox supplements. I had her take 2 of those twice a day. And I put her on something to support nitric oxide production because that can be diminished with ovarian. We want to support nitric oxide for mitochondrial function, for immune function, to support her immune system, et cetera. So I put her on a nitric oxide support supplement as well as another supplement called Arterosil, which helps the blood vessels and vascular function. So I put her on those few things and had her really, just kind of follow that plan, follow that program. And we did in 6 weeks, we did another AMH and an FSH, estradiol, and LH on cycle day 2. And so I had, so those levels showed that her AMH was now 10 times higher than it was when she came in. And so we scheduled
Wow, that's
her,
fast.
continue this, you're doing great. She was having a period again. And I said, okay, we're going to continue to detox the body, not ready to get pregnant yet. We need another 2 or 3 months before you get the green light to try. Again, we want to create a healthy environment. Whenever we can detoxify chemicals, toxin, hormone disruptors, pesticides, herbicides, all those chemical disruptors from our body, we want to do that before pregnancy when we have the opportunity. So she came in for her follow-up and she's like, Dr. Anna, I know you told me to wait, but then at that point she was 7 weeks pregnant. And of course she had some fear around it. She's like, I didn't expect it. And I was like, okay, this is good. Let's check the progesterone levels. Let's check how you're doing. And her progesterone was fine. We repeated it every 2 days for a couple times. And her progesterone level was fine. So that's good. So in other words, with a healthy progesterone above 20 in first trimester of pregnancy, especially after conception, then, I feel very low risk for miscarriage at that point. So everything looked good, and just kept her on her supplements that were safe in pregnancy, put her on a prenatal vitamin, increased her omega-3. So, we stopped, she had stopped already any of the high dose IV vitamin C. Not that that's contraindicated, but for safety, we switched to oral vitamin C. And so now she's 20 weeks pregnant, and baby, she's already done the, fetal ultrasounds, and everything looks healthy. And, just
Oh,
like, that's a miracle to me. Like, that just
Mm-hmm.
is a miracle to me. And,
yeah.
and when you see that, when you see improvements there, it's like, okay, so number one, it changed her life, it changed her longevity too. And so, yeah, so
Yeah.
it was powerful to see that. But that's not
Yeah.
something I really dealt with, 10 years ago. I mean, I
Mm.
had early menopause, but not from toxic overload or from, COVID or inject, the injection, the vaccination. And she had had 3 or 4 vaccines. And so
Mm.
definitely, wonder, did that have contribute to it? But I see it over and over again in young 30-year-olds. So, what's
Wow.
happening here? There's
Yeah.
a hormone disruption. So we have to support our body's detoxification of whatever, empowering our body's own natural function. And
Mhm.
so, and not to give up hope, right? Not to give up hope. I think that's really, really powerful.
Yeah.
Yeah, the
Mindset.
mindset. And I mean, those are all such amazing natural things. Like you said, not only is it supporting fertility, but longevity and overall health. And it's interesting timing. I was texting with a friend yesterday. She's been trying to get pregnant for 2 years, and she went to a fertility clinic. They ran some blood testing, which I found out all they tested for were STDs. And they said, we don't know why you can't get pregnant. You should do IVF. And I'm like, they didn't check your hormones? They didn't even check her hormones. And so then she's like, what about this at home test? It looks at, it was LH, FSH, estradiol, and testosterone, but it didn't say anything about what day to test. And I think there's just so much misinformation about
Oh,
of that. I was like, yeah, maybe I could, are you taking new patients? I could send
Yeah,
her your
yeah.
way.
Well, and definitely like patients now we can order lab test ourselves, right? Like I use Ulta
Yeah,
lab test for so much for my patients, Ulta my panels, and you can look and compare. My panels are at ultalabtest.com/ Dr. Anna Cabeca. So Dr. Anna Cabeca. And you can see my elite panels. It's what I do on my patients, but you can self-order those. But also like
great.
knowing what to ask and when to test is really important. So for
mhm.
cycle
Yeah,
day 2, when we're looking at ovarian reserve, on cycle day 2, first day you start bleeding is day 1. So ideally day 2 or day 3, but I try to aim for cycle day 2, is to look at that FSH, LH, estradiol, and an AMH if I want fertility. So
okay.
anti-Mullerian hormone is AMH. And so look at those numbers, and that gives us an idea of ovarian reserve, but don't be intimidated by the results if they're low. They say, okay, well, that's a marker, that's a measure, that's one instance in time. How will it be in 2 months? Is it going up or going down? In certain numbers, like we want FSH and LH to go down, estradiol and AMH to go up.
Mhm.
So that says,
Yeah,
okay, I'm getting some good response here. I'm getting some
yeah,
ovarian resuscitation, and that's
yeah,
powerful. And with men, we'll look at some similar hormones and other factors too to look at what's going on there. Yeah,
yeah.
Yeah.
This is
Great.
perfect timing then. I'll send her to
yeah.
that so she can get the testing.
And day 21 progesterone levels too, so that you don't want to,
Yeah,
estrogen at the beginning of your progesterone at the beginning of your cycle is going to be low. But at day 20, between
right.
20 and 22, it should be at peak levels. So checking your progesterone during that time, and that's just a few dollars to check it. I mean, less than 10 for sure. And so
Mhm.
check
Yeah,
that day 21 progesterone level and see that number should be above 15 ideally. Um, and as much as possible. So yeah,
Yeah.
so I know there are
right.
things that we can do to improve it. And certainly that's true
Yeah.
in my life and the lives of the patients I'm seeing. So
Yeah.
Yeah.
Do you
Yeah.
think it's worth going just to test progesterone on day 21, or would you throw some other? I know, like if I go to get my labs, I'm like, let's do some things if I'm going to go
do
in there and get my
everything. So
blood.
yeah, if you look at
Yeah.
my elite panel, there's everything in there, including the complete cardio IQ panel, which looks at, your ApoB, your LP little a, your full, are you pattern A cholesterol or pattern B? Because again, hormones are derived from cholesterol. I want to know that we've got some healthy substrate there. And then
Yeah.
progesterone and pregnenolone, I like to look at those. And then of course on day 21 or anytime during your cycle, you can check a full thyroid panel, as well as a hemoglobin A1C and vitamin D. If your vitamin D is low, I mean, none of your hormones are working well. So you've got to optimize your vitamin D. And then, of course, hemoglobin A1C, homocysteine to look at your methylation, HSCRP to look at inflammation. So the highly sensitive or cardiac C-reactive protein. So I look at that. Sometimes I'll add in an iodine. I always include a uric acid test. They used to be part of our chem panels, and then they took them out. And I don't know why they were removed from our chemistry panels, but uric acid is a huge marker of metabolic function. So, so I threw that back in. And yeah, I'm trying to think what
I didn't know
else.
they used to
Great
be in the
list.
panels just naturally. I added back in, but I thought it was like this new novel marker. Why would they take it away from us? That's not very nice.
I used to be part of
Yeah.
every chemistry panel. Yep, I was trained on that. But
Mm,
we were
interesting.
trained that, you know, a level of greater than 8 is consistent with gout. But above 5.3, really above 5 in women, like if you look at women separate from men, I mean, you're getting a metabolic slowdown with a uric acid blood level or serum level above 5. So I like to see it below 5.
Okay.
Definitely. And also not
So-
too low as well, would you say?
Right.
Yeah.
Okay.
Well, what about iron, ferritin? Are you looking at that in terms of inflammation?
Yes, definitely look at iron and ferritin. Also, because post-pandemic, we see some abnormalities in iron stores and ferritin. And we know that the virus had like competing with iron, we're say haptoglobin, competing with haptoglobulin sites as well as zinc. So I look at red blood cell magnesium and red blood cell zinc.
Okay.
Okay.
Excellent. I love that.
Lots of
I
things we can
love
look at.
the blood chemistry. So awesome.
I do
Yeah.
too. And then, of course, then there's urinary hormone panels with detoxification markers. So then I like to do the Dutch Complete test, or there's the HUMAP test, or Meridian Valley also does hormone, you know, urinary hormone testing. So there are some other good ways we can do that.
Yeah. Are there any like big toxic things that you're seeing are really impacting women? I mean, we've talked about like, I mean, COVID, some more viruses, but anything more in our environment that has changed and
Yeah, you have to think
doing some
about what we're
damage?
eating, what we're breathing, what we're putting on our skin, the environment we live in. And so environmental illness has been one of the areas where my colleague and the founder of the clinic that I work at, Carpathia Collaborative, I've been an expert in environmental illnesses. So I've dug into more environmental illnesses, but specifically mold toxicity, mold issues, and heavy metals, of course. Like we want to, our body's been exposed to all of these things. And when we look at a study that was published in 2010 that looked at, I think it was 260, they found 267 chemicals in cord blood of infants. So in the cord blood, that's from mom to baby, 267 chemicals, and over 2/3 of which are known carcinogens. So we're starting off at a disadvantage if we don't clear these things. So clean skincare is really important, what we're putting on our skin, we're washing our hair with, washing our clothes with. And it brings up another issue that I just have to wonder if the chemicals that we've been using or the synthetic materials in our underwear or our panty liners, pads, is causing irritation, worse dryness, but also lichen sclerosis, vulvar dystrophies, abnormal changes to the skin, and it can be often mistreated. So I had a client this last week who said, you know, she had itching around her vulvar area, and, you know, she'd been treated with antifungals and still there. And I said, okay, so I examined her, and it was around the clitoris, periclitoral lichen, what looks like lichen sclerosis. So, you know, I treat it with, first with just to make sure, antifungals, clean up her diet, because, you know, our skin is a reflection of our gut. So clean up her diet, do a gut cleanse. followed my 10-day keto-green detox in my book, The Hormone Fix. So I put her on that, put her on topical and oral antifungals and Julva twice a day around that area to help improve the healthy tissue. And so she has noticed improvement in the last 2 weeks, but I'm like, gosh, because if it's not, I have to biopsy that area and see what's going on. But just, she's like my third patient in the last year that, again, and I see clients two days a week, and a full day for me is 4 or 5 patients now. I remember when I used to say 50 patients a day.
Oh my
So you guys,
gosh.
I really do I like my practice right now. I get to spend time with my patients. And so,
Yeah.
Time is a
so
luxury.
yes, yes. And it's so fun. And so, so 3 significant cases of lichen sclerosis. And where maybe I would see one a year, one,
Mm.
couple years, or, so there's some differences that I'm seeing.
Mm.
Yeah, I think that's so important, because maybe we can't pinpoint exactly what it is, but there are just so many sources of toxicity. And when maybe we could get away with a little bit in the past, there's just too many sources and the bucket gets filled so quickly. And I think we
Yes.
are talking more about plastics in the environment. And you already mentioned it, like our underwear, maybe our
Clothing,
hygiene products we use down there, skincare. I mean, all the recycled plastics that are in yoga pants.
Yep.
Renee and I were doing like a deep dive on trying to find clothing companies that are making stuff that's not toxic. It's
Let me
very
know.
difficult. It's hard to find. And the ones that are out there, like, they're not quite cute enough. I'm like, maybe in a year or two, they'll figure out the fashion, but
we might need to start our own clothing line.
I
Lauren,
think so.
you be the designer, the fashion designer, and I'll work on the ingredients. Yeah. It's definitely needed. It's
definitely needed. Definitely needed. That awareness is really, really important. So I think again, the chemicals, the parabens, the phthalates, so touching little things like touching a receipt. Never touch a receipt. Get an email
I get
receipt or
stressed
take
about
a picture of
like,
it.
Yeah, I know. I like throw it. If somehow I get it, I'm like immediately throw it down and go wash my hands. I'm like, oh,
yep, good for
it
you.
freaks me out.
Yeah. And so there's so many things. And then, like the antiseptics that so many people used, the alcohol-based antiseptics. I mean, and certainly there was the triclosan. We know that's a hormone disruptor that can affect our gut microbiome. So, and anything that affects our gut microbiome can affect our vaginal microbiome. So keeping our gut healthy, keeping our food diverse and with plenty of fermented foods and, probiotic rich foods. And then of course, keeping our vagina just clean, no chemicals, no feminine washes, no, really need to look at that more. I have 4 daughters, and they're like, when my daughter brought home this, I'm like, look at these ingredients. Can you pronounce any of those? I'm like immediately in the trash. And so, but if they think like, oh, I need this. This is what I'm supposed to do as a young woman. And I'm like, no, your vagina is self-cleaning. You are good.
Yeah.
Right. But if you're not doing the diet and taking care of your gut, then downstream we're going to have those issues. So we really have to reverse engineer that.
Right.
And go to the source.
Yeah.
It's a lot to think about.
Yeah. It's I didn't know we were going to even talk about like the fertility side of things, but this is so important. But maybe I can segue into libido and sexual health, because if you don't have a libido, then fertility is going to be really hard. It's going to be annoying, and just like you're going to have to schedule things and you're going to not enjoy the process. So maybe we can talk about some of your sexual CPR tips and
absolutely.
What's going on? Like why? Why? And I'm hearing from clients like younger and younger, I don't have a libido. Like it used to be maybe more 40s, 50s, 60s, but now I'm hearing women in their 20s and 30s, no libido. What's going on?
Or difficulty having orgasms or anorgasmic. And, like what are the issues going on? So way back in 2012, I created a program called Sexual CPR. The kind of fun name, but like, I heard so often, help doctor, my sex drive has no pulse. Can you help me? I'm like, oh, we need CPR. We need CPR.
Yes.
So Sexual CPR was born from that. And I teach and I always say I'm the sexual health expert, but I'm not the relationship or technique expert. You got to go to someone else for that. but I put
Okay.
in experts. But
We have
when it
Susan Bratton for that.
right, right. And so when it comes to sexual health, I mean, it's not just about testosterone, right? It's not just about, the body image. There's so many factors, and I identified in my work 7 key factors. And one of my first calls in sexual CPR, it's called Call 911, My Sex Drive Has No Pulse. And I go through a list of just introspective in each of these areas, whether it's medical, each of these topics have a list of questions: medical, relational, spiritual. I mean, what were your early thoughts about sex? What were you told? Were you
Mm.
shamed? Was there, sexual abuse or abuse in general? What was going on? What were your early sexual experiences? And this is for them to journal for themselves. And then say, what medicines are you on? Where have you tested your hormones? What are some hormonal issues, environmental issues, whether it's toxins in your environment that are affecting your hormones, or it's like your, you know, husband leaves dirty underwear on the floor in the bedroom and it's a total turnoff. So is the environment conducive to, relaxing and enjoying sex? And then there's 2, key secrets that I tell clients that you need to learn about each other. And the first one is the number one secret that, and back before I go there, I'll tell you the 2 secrets. But the first thing is like medical issues, for instance. So with medical issues, like many people are on antihistamines, or this is allergy season, and that can cause dryness and can block orgasm. So a simple
Mm.
thing like, addressing the allergies, cleaning up the gut so you're not sensitive to the allergies, seasonal allergies, et cetera, addressing sinus issues, fungi, whatever it might be. That's continuing the need for the antihistamine to begin with. I mean, addressing those issues. Chronic steroid use can affect certain blood pressure medications, and diabetes medications can affect sexual function. Antidepressants are hugely known to affect desire, libido, and interest in sex. So, so if we look at some of those things in sexual CPR, as well as solutions. It's very solution driven. First, it's knowledge and empowerment and kind of figuring out where are your blocks, what are things that are interfering with, at the core, your sexy, your desire, your passion. And our bodies are designed for pleasure. So I teach through the erogenous zones and teach through the anatomy of sex. That's an area of my expertise as a gynecologist. So what is the anatomy of sex? And what are areas that caused, that are maybe pain? If you have pain every time you do something, why would you want to do it? So your body will protect you by not giving you that desire or receptivity to, receive intimacy. So whether it's from vaginal dryness and whether it's from pain from an episiotomy, what could it be? And so we want to address those issues, fix them, because they are. I mean, there's not to date a client where I haven't seen improvement with those issues. So,
What are
wow.
some of the big causes of pain? You think you just mentioned 2, but anything else that people should be concerned about?
Yeah, well, if there's any pain with sex, you definitely want a good gynecologic exam and a pelvic ultrasound.
Okay.
So you want to get both of those. And, endometriosis can cause pain, but hey, we can heal from endometriosis. And so there was certain things we can do to increase our pain threshold. And vaginal dryness as we age, the hormonal changes, but even from hormonal contraceptives or a hormonal IUD insert can cause vaginal dryness. So being able to address the tissue, of course, one of the reasons I created Julva was to address vaginal dryness and to reach the deeper layers of the tissue to create your own natural moisture. So it really does reverse the hands of time, and your body produces own natural moisture, lowers the pH of the vagina. So less infections, less of those, stopping that fishy odor, and that can make a really big difference. So that,
Okay.
and then of course, vaginismus or vulvodynia, those are pain disorders of the vulvovaginal area, the opening to the vagina. And it's important, if you're having pain, where is that pain with, if there's pain with sex, is it on penetration or is it with deeper penetration? Where is that pain happening? And that helps us identify where it could be.
Okay. So
Oh,
definitely want to get an exam to
okay.
rule out potentially something more serious or medical. Could you
Yeah.
comment a little bit more about endometriosis? We've talked about it a little bit on the show, but I think it's still such a mystery to people, or people say that it's a big mystery. Like there is no sort of solution for this. My understanding is that it's an autoimmune condition and we need to look at GI inflammation. What are you seeing, and do you think we can heal it completely?
I definitely have seen endometriosis improve and people heal from endometriosis completely. And I think it's really important. That goes beyond, even post hysterectomy and removal of the ovary. So when I have a client with endometriosis, diagnosed with endometriosis, I want to address inflammation in the body. I want to address what happens is you get an increase in prostaglandin production. There are many theories to what causes endometriosis. In my 30 years of practice, we're no closer to pinpoint one reason. We just don't
Mhm,
have it. But what I know, there's a common thread: hormone imbalance and inflammation. That's
mhm,
a common thread. And so first
Mm.
we have to clean up the body, the detox, detox the pathways, all of that. So I'll give you an example of a 16-year-old who had come to see me from Puerto Rico. She had already had 2 laparoscopies for endometriosis, and the third was to remove that she was scheduled for a third to remove one of her ovaries. And so her mom brought her to me. And she said, I really hate to think of my 16-year-old having to lose an ovary, and, she could still have pain and endometriosis from the other ovary. And so I talked with this young, really smart girl, and she said, I miss a week of school every month. My period is
mhm,
horrible. It hurts all the time. And, and I always have to work so hard to catch up on my work at school. And so she, so I sat with her and I said, well, first of all, she has like, the genetics or, presentation too of like PCOS. So at the start of her period, age 13, she gained 20 pounds, had acne. So she's a high hormone producer, which is a blessing. Where does those are, like when you have this propensity towards like the high hormone production, we tend to call it like high testosterone production. We tend to call it PCOS, but it's really like a warrior physiology, right? You're designed to
mm,
be leaders. You build muscle fast. You're survivors, right? You've great
Ah,
intellectual multitasking ability for the most part, right? Great focus, can have all of this. So I said, but you're not designed to sit 8 hours a day and study another 4 hours a day and drink soda and, and so those are things that work against your nature, your natural design. So if we can work
mm,
more with nature, are you game for that? And she said, absolutely. And so she was smart. And I said, first thing, you're stop dairy. Like think of hormone disruptors. We want to eliminate any other additional hormones to our body, hormonal burden at that point already. And her body's ability to detoxify hormones is important, that we support healthy detoxification, because she gets those estrogen dominant symptoms. She gets breast tenderness. She gains a few pounds each period. She has severe pain and cramping. I'm like, okay, we got to support your body's elimination of the excess hormones from that time. And
mhm,
so
yeah.
eliminate ones that you don't need in your diet. So I take my clients off dairy, and all my books, they're dairy-free, gluten-free, medicinal menus that are designed to support detoxification and hormone balance. So have her start that. And I put her on MightyMaca, which is like one of my foundations. I had her to 1 scoop twice a day. And I put her on product Zenful. So it has a combination with calcium D-glucarate and DIM to extra support for estrogen detoxification. I had her drink water instead of sodas. I'm like, just give me 2 months. Just give me 2 months and let's see how you do. Take her off milk and eliminate sugar to the best of her ability to eliminate sugar. That's it. That's it. I didn't prescribe anything. I didn't give her anti-inflammatory, I did, other than what was naturally occurring in MightyMaca. So 6 weeks later, her mom calls me. She had her period and she didn't miss a day of school. She didn't even know it was coming. And I will tell you that that girl graduated valedictorian. I mean, she just makes me so proud.
Oh my
So
gosh.
I
What a
know, right?
story.
Until today, she's graduated. I've been able to follow her. So she's graduated college and she's doing incredibly well. So
Oh my
yeah, so
Wow.
it's,
gosh.
and that's just in that short amount of time. And she knows, she says, when I go off regimen, I start getting cramps again. So just simple,
Mm.
simple solutions and she never needed another surgery to date. God,
Ah,
thank God she's never
Wow.
needed
That's
another
so
surgery.
incredible.
Mhm.
changed
I
her
know it's not
life.
one thing, but did she report back like one or two things that were really the biggest changes for her?
I definitely think dairy was a big culprit because her skin cleared
Okay.
up. She felt better
Okay.
about herself, less inflammation, was able to lose weight, and the sugar. I mean, those are two
Mm-hmm.
things. And then again, like that supplementation to support detoxification when not naturally occurring or not in your diet. So if she could incorporate more of the like broccoli sprouts, crucifers, ginger, et cetera, in her diet, that would support her more too. So I think the combination
Mm-hmm.
of things definitely.
Mm,
Yeah. Wow. What a
that's
success
great.
story.
Yeah.
It's incredible.
Yeah.
Just small lifestyle and food shifts.
Yes.
How much are you
Ooh.
still using? Yeah, go ahead.
Well, then I was thinking about another client I had.
I love the
I love
stories.
hearing,
Let's
I
go.
yeah,
know,
these
I know.
protocols are
I do too. I do
phenomenal.
too. She's 47, but she had a hysterectomy for endometriosis when she was 37. So 10 years prior to coming to see me.
Mm.
She lives in South America. And so she had so much pain, and that now she stated like they didn't give her any hormones because of the history of endometriosis. They didn't want to reignite any endometrial pockets, right? Didn't want her to have pain. So that she was told she couldn't have any hormones. And
Mm.
so she went rogue, and about a year before coming to see me, she went and got testosterone pellets, and she felt okay with them, but she was still like significantly, off balance. She didn't feel good in her body. And here she's like, executive founder of a multi-million dollar company. And so she also said that when I have sex with my husband, so I love my husband, but it feels like knives are being jammed into me. It feels like knives are being jammed into me. And like her doctors didn't address it. Like, okay, well, we've done your hysterectomy, we removed your ovaries, you had endometriosis, you're not a candidate. And I'm like, that's just crazy.
Mm.
So I examined her and she like at that, I mean, she had the vagina of a, 80-year-old, I don't know. And it was very,
Jeez.
very tender to exam, even with a Q-tip and the tiniest speculum. So I work with her to do some vaginal hormones very, very safely, use Julva, clitoris to anus to revive that atrophic tissue. And, again, dietary nutrition. So for me, Keto-Green 16, MightyMaca, it's part of my armamentarium. And then again, working with her specifically for vaginal hormones because of the significant discomfort. And, follow-up ultrasound. Is there any areas that we need to see? Is there any, sometimes there's regrowth of ovarian tissue after removal of an ovary. So you want to rule those things out too. Is there any other reasons for her pain? And I would just say that she's doing so much better now. Like she's able, she's just doing great. Like we reversed the
Yeah.
age of her vagina by I don't know how many years, by at least 20 years, and if not more. And she is like at home in her body. She feels more mentally alert and awake and oriented because I put her on progesterone also. So, like there's that myth. If you don't have a uterus, you don't need progesterone. So, but progesterone helps our brain, our bones, our skin,
Mhm.
our fascia. I mean, it's so crucial. Helps us get a good night's sleep. If and it helps with mood. If only for the sleep, a benefit of progesterone, it's hugely beneficial. So the combination
Yeah.
to help support someone. But again, it's not just about hormone replacement. I like to say hormone replenishment. We don't want to just replace because we want to support your body's natural production and
Mhm.
continue to support it. So that's related to the entire HPA axis. So we want to support your body's natural production, make as much as it can, support the ovaries, support ovarian function for longevity, adrenal function. It's got to take over when the ovaries give out. So support your adrenal glands and address, again, support a circadian reset, circadian rhythm, so that you're getting good night's sleep and you have energy during the day to do everything you're passionate about. So those are pieces that are really powerful. And in sexual CPR, I kind of go through these different modules and give that empowerment, that information.
Excellent.
Oh,
I love that
that's-
she
yeah, yeah.
reversed the age of her vagina. I feel like that's like the new biological age test.
Exactly. Better than,
my
better
gosh.
than like
We
a
go backwards.
DNA age, right?
Yeah.
Yeah. Yeah.
That's going to be the new test. Yeah.
Yeah.
Totally. I'm curious to know a little bit more about the adrenals, because of course, as we go into menopause, that function goes down, and just telling a woman to manage her stress is not really the solution. Well, any other tricks up your sleeve
Yeah.
for supporting
So,
adrenals?
so the antidote is always oxytocin, right?
Ooh, yeah.
Always
Oh, there we
oxytocin.
go. Yay.
So I
Okay.
say you have to oxyplay every day. You have to have some oxyplay every day. So that means how, again, our body and its amazing pharmacy is, I mean, it's the best pharmacy in the world. So we make these hormones, we make oxytocin, we make, anandamides, we make bliss hormone. We do this. And so being able to tap into that, and I've learned from visiting, experiencing some of the most war-torn, tragic areas in the world, like how can you be happy, right? And they're happy because you're in the present moment and you're focusing on things that you love, you appreciate, and even in dire poverty, you're giving to others. You're being hospitable, you're being gracious, you're doing all of those things that increase oxytocin. You're caring about your neighbors, you're celebrating life. In traditional societies, they celebrate weddings for, at least a week, if not more, right? There's a week-long celebration and everyone's invited. So in my own Palestinian heritage, the parties that you have, the bride's party, there's 800 people. You have the groom's party, everyone's there. Then
Wild.
you have the wedding party and there's like 1,000 people. So
My gosh.
yeah,
So more
That's the way to
parties.
do it.
more
Or
celebration. That's when,
at the very least, more music and more dancing.
more music, more
Yeah.
dancing. When Dr. Paul Zak researched oxytocin and looked at, oxytocin in a wedding situation, again, weddings were designed to join families to support them as a community. Well, you would suspect that oxytocin is a hormone, a happy hormone of that union. Oxytocin creates that bonding. So hence the celebration. And what was interesting, and he was doing blood samples of oxytocin. So the highest blood sample, as expected, was the bride. She had the highest level of oxytocin. The second highest was the mother of the bride.
Oh,
I
that's
know,
cool.
I
So
know.
cool.
Isn't that
I
beautiful?
love that.
I could
Yeah.
totally see that.
Yeah.
Yeah. Well, and Lauren just got married. So thinking back to her wedding
Congratulations.
day, I can totally see that. Yeah.
We only had 3 days though. Can we do a
3
few more?
days. Oh, that's awesome. That's awesome.
Well, the gathering on Friday, Saturday rehearsal, more gathering, Sunday wedding.
But isn't it true? Like you feel that bond, you feel that connection. Like, and with childbirth, you have that oxytocin connection that imprints you to this child that you will protect with your life. And so that, part of that physiology is the oxytocin, the imprinting. And through traditional like development of how do we create healthy bonds within families? How do we experience the healthy nurturing till a child leaves the nest, or I don't know when that happens. I haven't experienced empty nest yet, or open nest, or whatever you want to call it, or, and then
nest.
to families and relationship longevity of marriage. It takes a village, right? It takes a village. And then how are they bonded to you? So I think that bond support is important within a family, within a community, and you
Yeah.
guys in your sisterhood, I mean, that bond is
Yes,
powerful.
we have lots of oxytocin between the two of us, I think. But
Yes, you do.
Yeah.
Yes, you do.
beyond community, I guess I'm curious, what's the half-life of oxytocin, and how often do we have to do these practices to keep
Every
it
day.
flowing?
Every day. So, okay. So the research shows, and women and men, it's different. Okay. In women and men, oxytocin functions a little bit differently. But in women, like say, for example, just follow physiologically what happens for conceiving, for conception. So with our menstrual cycle, we peak in testosterone, estrogen, and estrogen in our when we ovulate. So we get a surge of LH and FSH. It stimulates the ovary to release the developed follicle, the egg from that developed follicle. And then progesterone increases from that corpus luteum. That follicle closes up. Now it's a progesterone producing factory. We get peak levels of progesterone. So essentially it creates an environment, a very lush environment within the uterus, the endometrial lining, so that the embryo can implant and safely develop. So the first part of our cycle is kind of like throwing sheets on the bed. And the second part of our cycle is like making the bed. Oh, it's so nice. Let's just climb in. So that sets the stage, and progesterone functions that way. So now if you have sex during that time of ovulation, you're most fertile. And that's when you're like, maybe I'm interested. I get a peak of interest. And you're more attractive during that phase of ovulation too. You're more attractive to the opposite sex. And so then you have sex, and for women, you feel bonded to that person for at least 2 weeks. Typically 2 weeks. And so that
Wow,
oxytocin
that's
is
a long
there.
time.
And
Yeah.
then when you're in the evolutionarily, you think, okay, well, at that point, you're pregnant or you're not pregnant. The pregnancy's held, and now your placenta will also produce oxytocin. The corpus luteum produces oxytocin. And so you have this kind of persistent connection. And then if you're not pregnant, oxytocin drops off, and then also it will wane and potentially in pregnancy too. But it's designed,
Mhm.
okay, I still, now this partner that I conceived with is part of my, life, has to help me take care of this child. So hence
Yeah.
the evolutionary reason for that attraction phase, that commitment phase of oxytocin to be more persistent in a female than a male.
Mm.
Makes
It's
sense.
interesting. So then you can
Yeah.
make bad choices too, right? You have sex, you have good amount of oxytocin. You're like, oh, well, I thought it was just going to be, I knew he wasn't right for me, but maybe I can make him work.
Oh,
Uh-oh.
I mean, I definitely feel it for like 48 hours. I mean, with my husband, like for like the next 48 hours, I'm like, man, I really love you a lot. Feel like that
Right.
extra boost.
You
And so
feel
what
it.
happens, what happens during pregnancy? You said, so it rises. Does it kind of stay the same throughout pregnancy?
Yeah, I'm
Or,
not sure. I'm not 100% sure like how it goes, how it changes through the first, second, and third trimesters. It's typically higher than baseline or than the follicular phase, but haven't seen any good research on that, any good
okay.
data. But then oxytocin comes in again because oxytocin is the hormone of labor. And people listening may have received oxytocin exogenously during labor. It's called Pitocin. That's bioidentical
Right.
oxytocin we as obstetricians will give if we need to augment or speed up labor. And that's oxytocin. And so, so that's helps the uterus contract, speed of intensity of contractions. And then again, when you deliver this baby, oxytocin is analgesic. So it's a natural pain reliever. It is amnestic. You forget how much pain and how long of a pregnancy 9 months really is. You tend to forget that stuff and then go on to have another child.
So
But
that's the trick. That's how you have a second and third kid. It's that
that's
part.
gotta be it. And
Oxytocin.
4 for me, right?
Oh my
And
gosh. Yeah.
but that bonds you, like that experience. And from having my own children, that experience of like, what love feels like, but you don't know what love feels like until you've held your child in your own arms. And you have that incredible bond and that imprinting and that like heart explosive experience. So that's how it was for me. And so, I love the natural birthing process as much as possible to really work physiologically with how we're designed to connect and,
Yeah, it's beautiful.
Yeah.
and they're still in my house. So that's something to it. I blame an oxytocin.
Hugs
Sounds like
every
a
day.
t-shirt. You should make a
Yeah,
t-shirt.
blame oxytocin.
Blame it on the oxytocin.
And what about men? I feel like maybe I
That's
heard this
actually a
from
great
you,
t-shirt.
something about men looking at their babies, then the baby like transfers, and then the men kind of let down their aggressiveness. Was that you that said that?
No, I know, but it's,
You
I
know what
did
I'm
say that.
talking about? It like calms the men when the baby connects with the dad.
That's oxytocin. An oxytocin for men
Okay.
is a hormone of trust, right? It's the
Ah,
trust. And that sense, like, with trust and safety and that connection piece, it's still there. But for them, it's that relaxation. It relaxes them. It makes them sleepy. Oxytocin makes men sleepy. Like after orgasm or after sex, women want to connect and really relish in that intimacy, that connection, and men want to roll over and fall asleep. So you gotta
again, blame oxytocin.
right. That is a t-shirt. We're gonna do that. That's got to be in your organic fashion. Uh,
Yes,
Yes.
non-toxic.
Okay,
Yeah,
I'm making a note of this. We
put it
gotta
on our clean underwear.
blame the oxytocin. It's funny. I don't remember what movie I was just watching the other day, but the woman had her baby, and the husband insisted on having his shirt off so he could hold the baby skin to skin. And he was like, "It's for the oxytocin." But the mother-in-law was like, "Put your clothes on. Why do you have your shirt off in the delivery room or something?" But he's like, "The
That's
I love that.
oxytocin." Yeah.
that's so
I remember
funny. I
where I
love
saw
it.
that.
Right. That bonding experience. Yeah.
Yeah. I can't even imagine what that feels like to to know that, that baby came from you. I just can't even imagine what that feels like. It's got to be the most beautiful experience.
And somewhat terrifying at the same time.
Both
Yeah, I
can
can see
be
that.
true.
Worry starts with the positive pregnancy test. It really does.
Mm,
And it
mhm.
doesn't end. We were just with our mom and dad, and our mom was like, I still track you guys, see where you're driving. I still worry about you. And we're,
Sure does.
coming up on 40.
Yep.
Yeah.
I'm okay with that. Totally okay
Yeah.
with that.
Yeah.
Yeah.
Yeah. All right.
So
Well,
I think this has been amazing. Thank you for everything that you've shared. I just wanted to touch on one more thing that you mentioned before we started recording today. Your favorite book.
Oh, yeah. Talking about sex right here.
Talking
One
about
of
sex. Yeah.
one of my definitely one of my favorite authors of all time is Paulo Coelho, a Portuguese writer. He wrote The Alchemist, The
One of my
Alchemist.
favorites.
It's an
Oh.
excellent book, and he also wrote a really popular book called 11 Minutes. And 11 minutes, the title comes from the time he says it's the normal length of a sexual encounter is 11 minutes, like from approach to finish, right? That's 11 minutes. And I was like, really? And like I've timed me and my husband at the time. I was like, is it 11 minutes? Sometimes less. All right. So you want to
Yeah.
figure that out. So 11 minutes. And it starts off, it's kind of interesting the way it's an excellent writer, but it starts off with once upon a time, there was a prostitute named Maria. And you're like, okay, wait, this doesn't sound like a fairy tale, right? Hold on a second. But he goes through telling her story of from when she lived in Brazil and then was offered a job as a model in Switzerland, which turned into being a prostitute. And she talks about her encounters with men. What do they want? They want a mother figure, a confidant, and or just that quick relief but mostly it talks about that and talks about it goes into some BDSM versus lights. I mean, it's a beautifully written book, but part of that book he also talks about the pilgrims that go through this town to walk the Camino de Santiago, this pilgrimage. And so I brought it up because I'm walking the Camino de Santiago this summer for my 58th birthday.
So awesome. Can't wait to follow you.
Yeah.
Will you be documenting along the way, or will this be kind of a solitude trip?
I haven't decided yet.
Okay. All right.
You got to see how you
We're here.
feel.
We're here waiting.
Yeah. Yeah.
Amazing.
Oh, well, that's the 11 minutes. That makes me feel a little bit better because I've talked to friends that are like, oh, yeah, it was 3 hours. I'm like, what did you do for 3 hours?
There's no way that's happening all the time.
Yeah.
Yeah. Especially because they have kids. Like,
Yeah.
there's no way that's
Yeah. Did you get a babysitter for that?
weekly. Yeah. Yeah.
And then making
Yeah.
prioritizing time, because like as you mentioned, when you feel that intimacy and connection, I mean, it's very relationship bonding. It's nurturing. It's those feelings, and to continue to cultivate the hormones of intimacy and sex. I mean, I say sexual health is necessary for optimal health. It really is, and there's no age limit on it.
Yeah.
There's no age limit on intimacy. On our body is designed for pleasure, and that doesn't stop. That doesn't stop with menopause. It doesn't stop, in our 80s. Our bodies have erogenous zones all over them. And in my program, Sexual CPR, I go through some of that, as well as male versus female erogenous zones. So it is, I mean, it's kind of important to understand, like, to develop and to be curious, and to express what feels good, what you like and what you don't like. And working with so many patients,
Yeah.
sometimes they haven't expressed what turns them off. And
Mm.
also, to really identify what makes you happy, what brings you pleasure in and outside of the bedroom, right? In all areas of your life. To be able to tune
Yeah.
into that creates a quality, passionate life. And that's physiologically healing. So it's important.
My husband loves sending me headlines of like, study found that having more sex, increased BDNF or brain function, or, all the health things. He's like, see, like
Absolutely,
Science.
absolutely. It's, again,
science.
produces the best chemicals.
Yeah.
Mhm,
Yeah.
mhm.
Oh, yeah. And I think the communication piece is so important. So thank you for speaking to that. Well, Dr. Anna, before we let you go, can I ask one final question? Leave our audience with one piece of advice, something they should do today to optimize their health. What would that be?
I think the one thing, and just there's so many, right? But the one thing
Yeah.
is, like, tapping into what really makes you happy, what brings you pleasure. And can you do more of that? Where can you play more in your life? Where can you authentically play? Tap into that, that childhood curiosity and that abandon. Where can you do that more? And then with that, lifting yourself up, lifting others up with you, incorporating that into your life. So for short, I call it oxyplay. So bringing more oxytocin into your life, but really thinking, what brings you pleasure? What makes you happy? Where can you bring joy to yourself and to others?
Yeah.
I think that's an
Beautiful.
amazing biohack.
Oh,
Mhm.
yeah,
Yeah, one that's overlooked. So
One that's
powerful.
overlooked. And I say that not
definitely.
from a place of ease and comfort. I say that from a place where I knew severe trauma. I've known severe grief. I've been, I was not even 20 years ago suicidal, right? So, and depressed. So it comes from this place. Like, I know what worked to heal me and what works to heal the clients I work with, even in the midst of severe trauma.
Mm.
And I mean, it makes a difference. And
Yeah.
it's transformative.
Mm,
Thank you for
yeah.
sharing that, and thank you for the work that you are doing. Yeah, we're
Yeah.
so
Thank you for
lucky
the
to
work
have you
you're doing.
here.
Oh, anytime. I love
Mhm.
catching up with you girls. Can't
Yes,
wait to
Oh,
have
always.
dinner with you and your families at some time.
Oh yeah, you're always
yes.
invited. It's always so fun to see you and run into you. So
I know. I get so excited when we're at a conference and I see you there. Like, yay.
I know, and I
yeah,
loved it
So
when I met
great.
your mom and dad. So it's a
Yeah.
family affair.
it is a family
Yes.
affair. Yep, we
Yes.
travel in a pack.
The 4-pack. Well,
Well,
this
thank you
was
so much for
so
hanging
great.
out with us today. We are going to put all the resources so our audience can find you, and go get the Women's World magazine on your nearest
Yeah.
magazine stand. That is so exciting. Yes, you look fabulous. And then your website, of course, has all of the resources like the sexual CPR, magic menopause. You have so many resources, like an amazing blog, recipe. The recipes alone are like, I want to be in my kitchen and make all these things. So thank you for all the resources that you have shared. And so lovely to chat with you today.
Always lovely to chat with you too. So yeah, thank you. And just for short, my website is dranna.com. So really easy, DRANNA.com. And follow me at The Girlfriend Doctor on social.
Perfect. Thank you
Right.
for sharing that.
Easy. You locked up a good website, dranna.com. That's awesome.
Mhm, mhm.
All right. Okay. Well, thanks everyone for tuning in today. We will see you next time.